Hi friends, today we will know about sleep apnea. To understand sleep apnea, we should understand how our body works. Our body is made up of cells. Many cells together form tissues that combine to form organs. All the cells in our body need oxygen to perform their function. Our body gets this oxygen while breathing. The function of the heart is to distribute oxygen to all the cells. When the heart beats, it pumps the blood into the lungs to pick up oxygen. The heart then pumps this oxygenated blood to all the cells to keep them alive and healthy. This cycle keeps repeating. One of the jobs of the brain is to monitor and control oxygen in the body. The brain manages this by signaling to breathe faster or slower. When our body is at rest, it needs less oxygen. But while we are doing some workouts, our body needs more oxygen, so we breathe faster. So, our brain, heart, and lungs work together to supply oxygen. Sleep apnea occurs when a person's breathing is interrupted in sleep. There are two types of sleep apnea: obstructive sleep apnea and central sleep apnea. Let's know about how obstructive sleep apnea occurs. This occurs when the muscles that supports the ulva, tonsils and side walls of the throat and the tongue relaxes. When the muscles relax, the airway narrows or closes as you breathe in, and you can't get enough air, which lowers the oxygen level in the blood. Your brain senses your inability to breathe and briefly rouses you from sleep so that you can reopen your airway. This awakening is so brief that you don't remember it. You might snort, choke, or gasp. This pattern can repeat itself every 5 to 30 times or much more in an hour, all night, impairing your ability to reach deep, restful phase of sleep. The other kind is a central sleep apnea. This occurs when your brain fails to transmit signals to your breathing muscles. This means that you make no effort to breathe for a short period. You might awaken with shortness of breath or have a difficult time getting to sleep or staying asleep. Due to lack of sleep, a person suffering from sleep apnea experiences daytime drowsiness, shows behavioral changes like being moody, depressed, or short-tempered. They find it difficult to concentrate at work. Sudden drop in blood oxygen level that occurs during sleep apnea increases blood pressure and strains the cardiovascular system, resulting in high blood pressure. Heart attacks, stroke, and abnormal heartbeats are also a result of sleep apnea. Let's look into the causes of sleep apnea. Excess weight. Obesity greatly increases the risk of sleep apnea. Fat deposits around your upper airway can obstruct your breathing. Narrowed airway. You might have inherited a narrow throat, or tonsils can enlarge and block the airway. Family history. Having family members with sleep apnea increases your risk of having it. Use of alcohol, sedatives, or tranquilizers. These substances relax the muscles of your throat and blocks the airway. Smoking. Smokers are 3 times more likely to have sleep apnea than the others. Smoking can increase the amount of inflammation and fluid retention in the upper airway. Hormonal abnormalities. Hormonal conditions like hypothyroidism may increase the risk of sleep apnea by causing swelling of tissues near the airways. As sleep apnea is caused due to the blockage of oxygen supply, doctors recommend to use CPAP. It is a machine that uses mild air pressure to keep airways open to breathe easily and have a good sleep.